Hello viewers, good afternoon to you all. I welcome you to Word of Life with Padre Okoromi Paul. I want to use this medium to thank all of you who have been subscribing to my YouTube channel, and I pray that God continuously bless you all for the effort you are putting towards spreading the message. Today I will be discussing another fundamental topic that is affecting humanity at this point in time, which is suicide. And I am not going to be discussing this alone. I have here with me Dr. Chibuzo Anoje, a resident psychiatrist. You're welcome now.
Thank you very much.
So, with the pandemic, we have seen a lot of cases of suicide, and it's becoming alarming daily. And based on that is your field, that is your area. So you help us to do a lot of justice there. And first I will ask, what is suicide, and what are the common misconceptions about suicide?
Okay, so suicide we can define it as an act with a fatal outcome. Okay. Well, if I want to put it plainly, when someone is carrying out or wants to commit suicide, the person knows that the act he or she is going to carry out has a fatal outcome.
Okay.
So the person is hoping or wishes that whatever act he or she is going to carry out will end in death.
Okay.
That is what suicide is.
So what are the common misconceptions?
Well, in this environment, the common misconceptions are that when someone decides to end his or her life, people would ask, why do you want to end your life?
Okay.
You have so much going for you.
Okay.
And we're going to be looking at that when we talk about the causes or risk factors, exactly.
Okay.
And then, of course, as Africans, we are very superstitious. So
everything we are attach it to witches and wizards.
Exactly. So when someone takes his life or attempts to take his life, there are common conversations around the person being controlled remotely from the village and all of that. So those are the common misconceptions around this part of the world. That first of all, people who commit suicide are seen as weak.
Okay.
You are easily giving up. Are you the only one who is going through what you're going through?
Okay.
Exactly. You are taking the easy way out.
Okay.
But it's much more than that,
Okay.
as we are going to see.
So what you are telling us basically is that the witches and wizards, they have no hands
They
in
do
there.
not. They do not.
Anyway, thank God for that,
They
at
do
least,
not.
because so many persons, especially just like you said, in this part of our world, it is usually attributed
Yes,
to witches and wizards.
If I can give an example, a couple of years back, the very popular case about the young man who jumped off the bridge in Lagos.
Yeah.
I remember some comments on social media. I don't know, the people who made those comments, they were not in the vehicle with the young man, but there were comments about him just receiving a phone call before he jumped. So they controlled him via the phone. So those are some of the
misconceptions.
Yes, those are some of the misconceptions.
Wow, thank you very much, Ma. So what are the risk factors and the causes of suicide?
Okay, we're going to divide it. It will be easier or better instead of doing it randomly if we divide it into groups. Okay. We'll divide it into two groups. Okay. Psychosocial factors. Okay. Psychology of the person and the social factors going around, and biological factors. Okay. So if you are going to, let's start with the biological factors. First of all, the commonest risk for suicide is a previous attempt. Somebody who has tried to commit suicide before and did not succeed is at a very high risk of trying again.
Wow.
So on top of the list of causes or risk factors.
Okay.
A previous attempt.
Okay. It's likely to.
Yes.
Okay. Wow.
Okay. So that's number one on the list.
Okay.
Then you are going to talk about mental illnesses.
Okay.
Now, 90% of those who have committed suicide were suffering from a mental illness at some point. And evidence has shown this.
But these things are not, especially in this part of the world now,
yeah.
we don't really attribute it to mental illness.
That's part of the misconception
Okay.
we were talking about. So 90% of people who have committed suicide were suffering from a mental illness.
Wow.
And so the commonest ones we are going to include depression.
Okay.
Depression is one of the commonest causes of suicide. Okay. When someone is depressed, I might digress a little, but just to make you understand, sadness is different from, when people use depression, it's like they confuse it with being sad, regular sadness, exactly. So when someone says I'm depressed, people will be like, why are you depressed? What's the problem? But you can feel sad at some point. I mean, those are regular things you would feel. If you lose something, you lose someone. Yeah, but depression is different as an illness. When you start to feel unhappy, you can no longer function. You start to lose interest in things you normally would do. Getting out of bed in the morning becomes a problem. You don't want to face life, and it gets to a point when someone begins to feel worthless, hopeless. By the time it gets to that point, the person starts to ask his or herself, what am I living for? Okay. So depression is a common cause of suicide. Now, substance abuse. People who abuse drugs, people who abuse alcohol, they are also a very risk. They are a risk group too. It's a risk factor for suicide. Okay. Then those who suffer from physical illnesses, that's those who have had cancer for a very long time. Somebody has been physically ill for a very long time, suffering. Has a physical illness for a very long time. They become suicidal. So, because if you've been in pain,
ease off the pain.
Yes, if someone has been in pain for a very, very long time, you're like, what
am I living for? Let me just.
So those are
causes.
Yeah, those are causes. That's just to list a few. Then, if you are going to talk about psychosocial factors, people who are undergoing a lot of social stressors in their life, poverty, is there. People who have gone through traumas, those who have gone through childhood sexual abuse. In this environment, when children are sexually abused by family members, uncles who are living with them, here we don't address those issues. Child try to hush it. They are going to bring shame to the family if you talk about it. But these things go on to affect these people for a very long time. So people who have gone through trauma, whether it's emotional, sexual, physical trauma, are also liable to suicide. Okay, and also those who are living, of course, we talk about poverty, social isolation. Those who are undergoing all sorts of social problems too.
Thank you. So what is the difference between deliberate self-harm and suicide? Is there any?
Yes, there's a difference between deliberate self-harm and suicide. Now, when somebody has deliberate self-harm is when somebody. The problem with deliberate self-harm is that there are a lot of people who have committed suicide, and it was deliberate self-harm. That was not their attempt. That was not the idea. They did not plan to kill themselves. But the method they used was, fatal, caused a fatal outcome.
Wow.
And then there were those who attempted to kill themselves, but the measures with which they used was not.
Okay.
And then they ended up in the hospital. For when they come to us, those are questions that we ask are very, very important.
Okay.
If someone comes and you're asking the person, where were you when you tried to kill yourself? Was anybody there? And they tell you, no, I did it alone. I wrote a suicide note.
Wow.
I wanted to kill myself. You know that person is going to try again. And most likely, the person will make sure that they succeed. So there are people who attempt, that's deliberate self-harm, hurt themselves, okay, as a cry for help.
Okay.
Yeah.
It means they did not plan.
No, they are just doing it to reach out.
Okay. So pass a message.
To pass a message. Okay. A woman quarrels with her husband and just swallows pills and try maybe an attempt to make him feel bad about it. Children who are in homes where there's a marital disharmony and they can't reach out. They are trying to adolescents who are going through emotional problems and they can't speak out. They don't know how to express themselves. But the problem with deliberate self-harm is that in doing that, the person might end up using a method that will end up killing the person. So usually when we see patients like that, we'll try to at least find out what exactly is the problem. What is going on at home? What's the stress? Where is the stress coming from? Is it from home? Is it from school? Is it from your place of work? And then, of course, psychotherapy comes in there, counseling that this is not the best way to address this problem. If you need to talk to somebody, talk, so that we can help you to find a way out of the problem. Because the next time you attempt, you might kill yourself, which might not have been the original plan. You are doing this as a cry for help.
Wow, that's serious. So what treatment do you prefer for someone who has attempted suicide before?
Okay.
The treatment,
When people are brought to the hospital and they've attempted suicide, because that's one thing we need to pass across. If somebody has attempted suicide, yes, I know we are very religious people, we cannot downplay that, but the person needs to get to the hospital first, because the method the person may have used would put the person's life in danger. If the person has taken what's this common sniper, drug sniper, person needs to be taken to an emergency immediately, because you have to save the person's life first of all before you even trying to attempt to find out whether the person has a psychiatric illness or whatever stressors the person has. Okay, so you get to the person get the person to the hospital immediately. It's an emergency. If the person has swallowed pills, women usually would use men usually use more violent means all over the world. It's like that. Men are the ones who would take guns, shoot themselves, jump from buildings, stand in front of a moving train, and even here hang themselves. So men usually use more violent means. Yeah, women are the ones who would buy over-the-counter medications and overdose on it. So first of all, you want to find out what happened. If of course it's a gunshot, if the person is still alive, the first thing is at least you must attempt to save the person's life. And then when the person is stable, if it is a substance use problem, alcohol problem, or a psychosocial problem, then you can address that. But life first. Life first.
So how do we prevent suicide? And what is the role of the government, the church, the society, and the family?
Okay. We'll start with the government. In this part of the world, or rather in Nigeria, the laws we have concerning suicide, I don't know, I find it very funny.
So we don't have laws?
Well, here, suicide is a crime. I hope you're aware of that.
Wow.
Yes, if you attempt to
kill oneself, it's a crime?
It's a crime. So, first of all, that's already a problem. And you know that, around the world, suicide cases are underreported because of the stigma that is attached to it.
Okay.
So if you're already having laws like this, people will not
want to come out.
Yes.
So wow.
So it's a crime
But
in Nigeria. That's the thing. So if somebody has killed himself or herself, the cops, are you going to arrest
the cops?
So
wow.
that's already something that we are trying to get the government to understand. The law is.
So trying to kill oneself is not a crime. That's strange.
So that is
wow.
Suicide is considered a crime.
Wow.
So the government needs to, understand that people trying to kill themselves are doing so because they have an underlying problem.
Okay.
Then we need legislation, we need policies.
Okay.
Mental health in Nigeria, we still don't have a lot of funding from the government. So they have a role to play. They have a role to play. Then I would also add the media houses. Okay. The way media reports suicide. Journalists have a role to play. Okay. They need to be, they need to be educated. Okay. Because there's a way you report suicide cases that you glorify it. Okay. And then when somebody is feeling, down or, out of sorts and is going through all of this, if somebody has committed suicide and it's all over the news and they are sensationalizing the whole thing, that person would look at that method and think that that's the way to...
So that the whole world can hear him or her.
So
wow.
The media houses too have a role
so they overhype it, the hyping, okay.
Yes, you can report it but don't glorify it.
Okay.
So they too have a role to play.
Okay.
Alright. Then also the church. You all have a role to play too. Okay. I don't know. The church has always had this stand of, you kill yourself, you are going to go to hell. Yes. They need to encourage people to seek help. If you are going through
depression
anything,
or anything.
yes. If you're going through anything, seek help. Okay? You can talk to the priest. Talk to the priest if you have any problems. The priest can counsel you. Counsel you if you have any psychosocial problems. The priest can counsel you. Okay. I mean, in church we have societies that can even help the underprivileged. Yes. So if you are going through any psychosocial issues, the church can help. Your priest can counsel you. Okay. If you need to go to the hospital at some point, the priest can also, direct you. Yes. And I think it will feel better for, a parishioner or a Christian if his priest is the one even saying, go to the hospital, go and see a doctor, and we do the two together. While you take your medications, we also continue prayer. You also continue coming to see me for counseling. So that's what I think. Then of course the family. Okay. I mean, life starts from the family. Yeah. So the family has a huge role to play here. Marriage, marital disharmony, what these things do to children, adolescents, of course, emotional abuse, sexual abuse on children, because those are where the risk factors start from.
Wow, I must confess that I have learned a lot. If not for anything, I have come to realize today that suicide is a crime in Nigeria, and I think that for me, looking at it, the government really need to
needs to, because that issue. As of now, suicide is the 10th leading cause of death around the world.
Wow.
Okay. If my figures are right, every 40 seconds, one person dies by suicide somewhere.
Wow.
In the world as we speak.
That's strange. Anyway, we hope that this message will go far, and those in authority can pick it up from there. I want to also at this point thank Dr. Chibuzo Anoje for coming around to enlighten us today on suicide. At the end of the day, what we are saying is say no to suicide. It is not the best way to solving any problem. Seek help when necessary. I want to thank you all for taking our time to listen to this message, and if you have enjoyed it, don't forget to subscribe to my YouTube channel. Thank you.